Welcome to Minimally Invasive Surgery Hospital Safety, Partners in Your Care program. Our safety strategy is to encourage patients to become involved in their own health care. The more you know, the safer you will be. So let's get started. Give information. The healthcare team in the hospital may not know you as well as your doctor, so it is important to fill them in. You can help by making a list. Write down any health conditions you may have. For example, high blood pressure, heart disease, sleep apnea, diabetes, or a history of blood clots. Write down if you have a device like a pacemaker, IVC filter, or mesh from a previous hernia repair. Or if you have allergies such as latex, shellfish, or a medication allergy such as penicillin. Write down if you have had surgery in the past, such as gallbladder removal, hernia repair, or a hysterectomy. Also, it is very important to make a list of all the medications that you take. Please note how much, how often, and why you take it. A medication list should include prescription medication, aspirins, ibuprofens, or any other NSAIDs, over-the-counter medications, vitamins, and even what you take from the health food store. Just because something is natural, it does not mean it can cause problems. We also recommend that you bring all your meds with you in a bag when you come to the hospital or for a procedure. Oh, and if you are a smoker, drink every day, or use recreational drugs, you need to tell your doctor. Your doctor needs this information to keep you safe. And you should know that anything you tell your doctor is private. Patient identification. It makes sense to make sure the correct treatment, medication, or procedure is being given or performed on the correct patient. We ask you to participate in the verification process. If you are being told something that does not feel correct, speak up and ask the staff to double check. Although it may seem repetitive, it is for your safety. You will see the staff re-verifying that you are who you are by asking you for your name and date of birth, frequently prior to giving you a medication, taking you for a test, or a procedure. You may also observe the staff labeling blood in your presence, marking a body part to ensure that the correct procedure will be done on the correct patient and side, and performing a timeout with the entire team prior to starting any invasive procedure. Get information. It seems obvious, but if you do not agree with or understand something that someone is telling you about your healthcare, treatment, tests, or a procedure, ask questions. There is nothing wrong with that. In fact, we encourage it. Make it your job to clarify and understand. So when in doubt, ask, ask, ask. Same thing goes for the medication you take. If you are given a pill that you are not familiar with, don't recognize, or don't understand why you are taking it, after all, it is your body and your health. Ask what it is before you take the pill. Do not think you are being rude or pushy. Simply state, "Can you tell me again what this medicine is for?" Or, "Can I take this with my other medication?" Or, "Are there any side effects?" Harmful mistakes can be prevented by asking simple questions like these. We also encourage the family to seek assistance or ask for help when they believe something is not right or they are concerned about the patient's condition. Bring a friend. It is impossible to remember everything a doctor tells you, or you simply forget to ask an important question. It happens to everybody. It is a good idea to bring a family member or friend along with you when you come to the hospital. Think of this person as your partner in your health care. He or she should be able to speak up for you, ask questions, and give information about your health. Always make sure your doctor knows it is okay to share your health information with your partner in healthcare. Keep it clean. Everyone knows that hand washing helps stop germs from spreading, and we all know germs can cause illness or infection. Simple hand washing or hand sanitizer use before and after contact can guard against and prevent accidental spread of infection from one person to another and keep you and others safe. It is all right to remind the nurse or doctor about cleaning their hands before touching you. You can help everyone by speaking up, something all of us can do to prevent the spread of infection. So don't be afraid to ask if the staff wash their hands, sanitize their hands, or if they should be using gloves before touching you. To stop the spread of infection, you can also help. For example, wash or sanitize your hands after coughing or sneezing. Use tissues. If no tissues are available, cover your mouth and nose with the bend of your elbow. If someone wants to visit you in the hospital and they themselves are not feeling well or are sick, tell them to please just stay at home. This can make a difference in controlling something as simple as the common cold. To prevent contracting infections, you can also check with your doctor about vaccines recommended for adults. Depending on the type of an infection a patient may have, your nurse or doctor may teach you and your family and friends how we can work together to control the spread of that specific infection. Since we are a surgical hospital, we are also concerned about surgical type of infections. We practice good sterile technique, simple hand washing, and good wound care to help prevent such infections. You can also help to prevent wound infections. Remove dressings when instructed. Keep wounds clean and dry. Protect wounds from trauma. Wash hands before touching your wounds. Do not soak wounds. Call your doctor if the wound becomes red or it starts draining. Know what to do. Now, when you leave the hospital after a visit or a procedure, make sure you have written instructions so you can take care of yourself at home and use them as a reference. Also make sure you understand which medications you need or may not need to continue to take. If you are given a new medication, you need to know why, the dose, and how frequently to take it. And if you do not understand something, ask. Ask. Ask your caregivers to explain it to you when you do not understand something or you have a question. Ask the pharmacist, the nurse, or your doctor to explain it to you when something is not clear. You should know what medication to take and what medications not to take, when it is okay to go back to work, why a test is being performed, and how to get hold of your doctor when you need help, and more. Home. Once you get home, staying healthy and safe is up to you. You are the first line of defense. Call your doctor when you are concerned or have questions. So remember, give information to your healthcare team about you and your health. Get information. If you do not understand something about your care or your medications, be sure to ask. Bring a friend. Having someone else around to ask and answer questions can really help. Keep it clean. Making sure your caregivers have clean hands helps everyone. Know what to do. Make it your job to understand how to care for yourself at home, how to take your medications, and how to seek help when you need it. And ask. Feedback. Mesh is committed to quality and safety. Please let us know of any safety concerns. If you have a problem or a complaint, don't hesitate to talk to us. Your nurse or the front desk will put you in contact with the correct person to help solve or correct the problem. And a suggestion box is always available in the lobby. The Patient's Rights booklet given to you on admission contains more information on how you can communicate with us and others if your concern remains unresolved. If you are not satisfied with the efforts of those involved, the hospital CEO and Director of Quality Improvement are also available to address your safety or patient care concerns. You also have the right to contact various organizations. Contact information for these organizations are also available in your Patient Rights book. Thank you for listening and choosing MISH for your healthcare needs. We wish you the best.
This PowerPoint presentation will discuss post-operative wound care, incentive spirometry, medications, fall prevention, and drain care for those patients with drains. Wound care. Good wound care is important in preventing wound problems. After surgery, your wounds are closed with stitches that are under the skin and covered with transparent tape. The transparent tape should be kept on for 2 to 3 days. You may shower, pat dry, do not rub dry. Avoid baths, swimming pools, and hot tubs until your incision is completely healed to avoid infection. Keep your wounds protected from rubbing at the waistline. Once at home, keep the dressing tape clean and dry. Remove the dressing tape after 3 days or as directed. Inspect the wound for any redness, weeping, swelling, or other problems daily. Always wash your hands thoroughly with soap and water before and after touching the wounds. Once the dressings are removed, do not use Neosporin or other antibiotic ointments, hydrogen peroxide, or alcohol. A new dressing is not recommended. Do protect your wounds from rubbing and moisture if necessary with a light, breathable dressing. Keeping the wound dry and clean is important. In healthy patients, most wounds heal within 2 weeks, but healing will probably take longer if you have a health problem such as diabetes, are taking certain drugs such as steroids, or have a weakened immune system. Eat a nutritious diet high in vitamin C, protein, and zinc to promote wound healing. You can find vitamin C in citrus fruits and green vegetables such as broccoli and Brussels sprouts. Meats and milk products are high in protein and zinc. You may have discomfort or numbness around the wounds at first. This is normal. Your surgeon will give you pain medication to keep you comfortable. For the first few days after your operation, take your pain medication regularly or at the first sign of discomfort as directed. Notify your surgeon immediately if pain suddenly gets worse. The wound may itch for a few days after surgery. This may be normal, or it may be a sign of a problem, such as infection. Don't scratch the area. Call your surgeon if you're uncomfortable. In the meantime, if you feel well enough, you can continue light housework and activities depending on where the wound is located. Light exercise will also help you recover faster. Talk with your surgeon about your normal activities so you know which ones are safe to do. Scars from surgical wounds are prone to sunburn, so keep them covered or apply sunscreen once the wound is healed. Consider using green-colored concealer under makeup to help hide a red scar. Lotions and skin softeners may soften scars. Infection can occur. Your surgeon needs to be notified should this happen. Call your surgeon immediately if you experience any of the following signs and symptoms: chills or fevers over 100 degrees Fahrenheit, warmth, swelling, redness, or more pain at the wound, pus, a bad smell, or more drainage from the wound or drain, sudden excessive bleeding from the wound or drain, a feeling of hardness or fullness around the wound or any opening of stitches. If your wound opens, cover it with clean gauze and call your surgeon right away for more directions. Always call your doctor when you are in doubt or have a question about your wound. 913-322-7408. A picture of the incentive spirometer used at MISH. The purpose of the incentive spirometer, IS, is to prevent a pneumonia. It helps the lungs reopen back to normal and induce coughing and clearing of any secretions in your lung airways. Most patients after abdominal surgery will have pain. The first thing most patients will do, take shallow breaths because it hurts to take a deep breath. The IS reminds the patient to take a deep breath periodically to prevent potential lung problems. Patients who do not use their IS are likely to develop atelectasis. Atelectasis is temporary shrinkage, collapse of the lung. Often the patient will have a low-grade temperature that will get better with more frequent deep breathing. The nurse in the hospital will teach you how to use the IS. Correct usage of the incentive spirometer is important. The depth of the breath is very important. We encourage patients to take a breather between breaths and take their time so they can take deeper breaths. We prefer one good deep breath over 10 bad shallow breaths. The IS has two floating devices, balls. One is larger and the other smaller. The larger floater raise as high as you can by inhaling, the biggest breath you can manage. Aim initially for at least 1,000 milliliters. The small floater keep afloat between the two arrows for at least 2 seconds. The bigger breath and the longer you can keep the breath in, the more effective the breath is at opening your lungs back up and helping you clear unwanted secretions. How to use the incentive spirometer. Take in a few normal breaths. Then get ready to take in the deepest breath possible, and to do so, raise the large float to at least 1,000 milliliters and keep the small float between the two arrows for at least 2 seconds. Let the air out and breathe normally again. Take your time before you are ready for the next deep breath. When it becomes easier to take deep breaths, keep raising the large float higher and higher.
Set the pointer of the incentive spirometer to the volume level that your caregiver has recommended. Hold or stand the incentive spirometer in an upright position. Exhale normally, then place your lips tightly around the mouthpiece. Inhale slowly to raise the ball or piston in the chamber. Continue inhaling and try to raise the top of the piston to the level of the pointer or as high as you can. When you cannot inhale any longer, remove the mouthpiece and hold your breath for 10 seconds or as long as you can. Exhale normally. Your caregiver may suggest that you cough deeply as you exhale. This will help bring up sputum so that you can cough it out. Ask your caregiver how often you should repeat this exercise. If you have had surgery, caregivers may tell you to use the incentive spirometer 10 times every hour while awake. Do this even if you wake up during the night. If you have other breathing and health problems, caregivers may tell you to use the incentive spirometer 3 times a day. Place the mouthpiece end of the tubing in the notch at the top of the incentive spirometer when you are finished with your exercises. This keeps the mouthpiece from getting dirty between uses.
We recommend to use the IS at least every 1 hour while awake for the first few days after surgery. Once the more severe abdominal pain, discomfort has subsided, you may not require the IS any longer. Only the good breaths count. Aim for 5 good breaths every hour. Medication reconciliation. Medication reconciliation is a process of comparing what medication the patient is taking at the time of admission with what the hospital is providing, admission or new medication orders, to avoid errors such as conflicts or unintentional omissions. Medication reconciliation starts when you are asked for your medication list. An accurate medication list can greatly help reduce potential medication errors. When you will be admitted to the hospital, one of the first things you will be asked for is your medication and allergy list. Please take the time to prepare an accurate and complete list of your medications prior to an admission, or even discharge from the hospital, or just bring all of your medications with you in their original containers whenever you come to the hospital. Your list of medications should include prescription medications, aspirin or Motrin, ibuprofen types of medications, over-the-counter medications, vitamins and other supplements, natural, herbal medications or supplements, allergies to any drugs that you have taken in the past. For any medication, it is important to know the name of the drug, the dose of the drug, how often you take the drug, how you take the drug, pills, injections, patches, and the reason for the drug. While in the hospital, it seems obvious, but if you do not understand something that someone is telling you about your medications, or if you have been taking red pills and now they are giving you blue pills instead, ask for an explanation. Ask what the blue pill is before you take the pill. Harmful mistakes can be prevented by asking simple questions. Upon discharge from the hospital, a discharge medication list will be provided to you. When the nurse is reviewing the medication list with you, please ask questions to ensure that you understand the list. Common questions are, which meds do I continue to take? Which meds not to take any longer? Or, when do I restart an old medication? If new medications have been added, make sure you understand why you will be taking that new medication, or for how long, and who will monitor you on that new medication. There may be medications that you were taking preoperatively that are difficult to take postoperatively. There are options available. Pills smaller than a pencil eraser should not cause a problem. Larger pills can be cut into smaller pieces or crushed. Extended release pills may have to be changed if they are large. Gel caps require acid to dissolve. You may not have enough for that to happen. Pills may be able to be converted to patches, liquid, syrup, smaller pills, smaller dose, chewable. Fall prevention. Preventing falls is high patient safety priority at MISH. We understand patients can have significant movement restrictions, limitations, and needs that may place them at a higher risk for falls. It is very important that these needs or limitations be communicated to the staff and your doctor. This information will be very helpful at increasing your safety and reducing your fall risk. The risk of not preventing falls can be serious. It can include significant bone fractures, traumatic head injuries, and potential loss of independence. We encourage patients to communicate with the doctors and nurses about their mobility limitations, fears, safety concerns, and needs to ensure a safe hospital stay and prevent any potential falls. You may notice several things during your admission that are automatically performed to reduce your risk of falling. Patient necessities are placed within easy reach. The nursing call button is placed within patient reach. The bed is placed at the correct height. The room may be emptied from unnecessary clutter and electrical cords. The wheelchair, chair, walker, or cane will be within easy reach. Any floor spills will be cleaned immediately. A patient fall risk assessment is performed by your nurse. The nurse will assess your fall risk by using the hospital's fall scale. Your risk for falling is assessed on admission, transfer, any change of status, and change of shift. We encourage patients to always communicate their needs or preferences to assist them better with movement and to help them feel safe when moving. Fall reduction measures are taken. Staff communicating with the patient family and patient family communicating with the staff is a very important part of patient safety. Staff ensures the patient is ready for movement. Staff ensures that the patient has slip-free slippers. Identified higher risk patients are moved to a room near the nurse's station. Patients are assisted in standing, walking, and transferred till they are comfortable on their own. Correct and appropriate equipment and devices are used to assist with movement. A lift team is available when needed, a team trained for patient transfer. Patient safety is a priority. Do not hesitate to communicate your needs or concerns when it comes to your safety. Lap band patients. Stop here and take your quiz and give it back to your nurse. Drain care. This is a diagram of the drain used at MISH. Drains are usually placed to drain blood or other body fluids from a cavity. After a procedure or an operation, you may have one. Your doctor will explain to you why you have a drain and approximately for how long you will need to keep it. While you require the drain, there are several things you need to know. Keeping the drain site dry and clean is important. You may remove the original dressings after 3 days. You may need to change the dressing around the drain site if it gets wet. Sometimes fluid can drain out around the tube site. To prevent soilage of your clothing, place a dressing around the site. Remember to wash your hands when performing dressing changes. You will need to empty the drain at least daily or when it is more than half full. When you empty the drain, follow these instructions. Wash your hands with soap and water using friction to all surfaces. Remove the stopper from the pouring spout of the JP bulb. Pour the fluids into a measuring cup and set aside. Close the stopper while squeezing the bottle flat. Record the amount in the measuring cup. Discard the fluid in the toilet and wash your hands.
Be sure to wash your hands with soap and water using friction to all surfaces. The JP tubing has been removed for demonstration purposes only. Remove the stopper from the pouring spout of the JP bulb. Pour the fluids into a measuring cup and set aside. Close the stopper while squeezing the bottle flat. Then record the amount in the measuring cup. Discard the fluid in the toilet and wash your hands.
Call the surgeon if the drainage becomes blue or purple at any time. If you are told to do the leak test, the drainage changes consistency or color. Changes may include a cloudy, milky appearance instead of a watery, runny appearance. It is no longer red, orange, yellow in color. A foul odor. The drain tube slips out. The site becomes red, swollen, painful, hot to touch, or has a drainage with a foul-smelling, thick, cloudy, and abnormal color. The drain site may become tender or uncomfortable after a while. Immobilizing the tubing or keeping the bulb tacked down can prevent tugs and accidental pulling of the tubing at the suture that can cause pain. Call your surgeon if the discomfort cannot be relieved. You will be provided with JP drain care instructions on discharge from the hospital. On that sheet, please record the drainage from the bulb and bring it with you to your doctor's appointment. Your nurse will provide you with a measuring cup and show you how to drain the bulb. Drain removal is rarely painful. The most frequent comment during drain removal is, "It feels funny." You may need to keep a dressing over the drain site after removal because of fluid drainage. The tract will seal in approximately 2 to 3 days. Any drainage should stop then. Keep the dressings clean and dry till that happens. Call for any signs of infection or persistent drainage from the site. Please take the short quiz and give to your nurse.